when the sequence was published in early 2020, it was published in Nature. We know by force, by a very honourable Chinaman basically leaked it. Otherwise, the Chinese authorities still wouldn't probably have let us know what it was.
Is that right?
It's very well documented in Matt Ridley's book Viral, actually, if anyone wants to go into it. Everybody assumed it was very similar to SARS and therefore was definitely a zoonosis. And they failed to note the changes such as a smoking gun, etc., etc. When I said they failed, the Chinese Wuhan group that did the sequencing showed that this site was there, and in the discussion, they didn't mention it. It was the equivalent of Nelson putting the telescope to his blind eye. They knew it was there, but they didn't want to draw attention to it. So at any rate, so this is what I basically wanted to know. If you could go on to the next slide, was that Berger and his colleagues there were really spot on, whereas I was continually back down, said, of course it's a zoonosis, because SARS was a zoonosis, SARS-1.
Yes, so SARS-1 there was an animal reservoir there. It was identical.
And this was similar, so it was assumed, but basically my cry was, let's look at the science, because this is remarkably similar to sequences that have come out of this Wuhan lab and have been published in normal journals in the West. So it's no conspiracy. It has this come from the lab. Well,
so let me just see what we've got here, Gus. So this nicely coloured bit, that's the actual molecules that comprise the virus.
This is the modelling from the molecule put on all electric very sophisticated modelling data from known proteins, etc.
So that's basically the virus there that you're looking at.
But what these little red things show, they're the inserts which have been inserted into the virus in the laboratory. Now, nobody's got time to go into all the details of this, that and the other. So you have to basically go up a gear. When you put in a lot of inserts, what does it mean? It means that you interfere with the logical amino acids that these sequences produce. And this is why Berger's observation was so seminal that I could understand it immediately without going on extra courses. And it's that simple. You can see there the yellow was the SARS-CoV-2 had basically a charge of over 8. Whereas the ordinary SARS virus, and it goes for the rest of them, have a charge of less than 6.
So this is a positive electrical charge, just like the positive pole of the battery. And that's there because there's lots of positive amino acids have been inserted in altogether.
This was done deliberately in order to make it more effective.
Because normally they would repel each other anyway, wouldn't they? So you wouldn't expect a lot of positive amino acids together.
Cell membranes are negative. So normally a virus would go hunting around the cell looking for a receptor.
Right. So you've got all these positive bits all clumped together. So that's going to electrically attach itself to the negative cell membrane. You've got virtual guaranteed penetration of the cell there.
It's the equivalent of a fridge magnet.
Yep.
It goes whang, locks on and you won't get it off.
Clamps onto the cell and that's it. The virus is well and truly glued to the cell.
It should only start attaching if it's got the right receptor and binds to it properly and the proper co-receptors. So that to me was seminal, absolute proof. And I went away and looked at these inserts, and there were publications saying they had put some of these inserts into cells to make them more infectious for human cells. So how on earth was this a conspiracy theory that was shut down? I mean, and I can say Matt Ridley says that he even took this up with prominent people in the Royal Society who told him, no, they hadn't looked at the sequences because there was no point. It was obvious it was a SARS. What's the point of a Royal Society that can't bother to look at the evidence? I mean, it's out there, absolute disgrace. And if I could then move on, the next slide. Basically,
so lots of positive bits there. So am I right in saying that because it's so positive, it doesn't actually need a specific receptor on the surface of the cell to adsorb into? It would just stick onto the membrane.
Well, it's so well finely tuned for the ACE2 receptor, it was always going to hit that. But if we could jump on three slides actually. This one. This is the one. This is
Yep.
ideal.
Yep.
We showed that that the charge was so strong it was able to use receptors other than the ACE2.
Yes, I've heard this.
This was important. We could bind to the co-receptor binding domain was used by a immunological receptor, but the ganglioside ones and glycoproteins, etc., it was able to attach to receptors that are involved in suppression of innate immunity, taste and smell. Does that ring a bell?
It does rather. So there's
this explains why so many people lost the taste and smell. You can with other viruses, but it's usually transient. But this was so vicious that I spoke to many people, lost the taste and smell for weeks and weeks at a time.
Oh, months, yeah.
I think this explains it. So here we had this very good evidence. And what I want to go on to that is that everybody said no. It came naturally. They searched wet markets, they chased dogs around and tested them, and they still couldn't find this elusive animal between the bat and the human. It did not exist. That's why, because it came straight from the lab, beautifully protected. So I want to go to the next slide now.
Can I just go, I'm not quite sure. I can't quite see why the loss of taste and smell comes from that molecular architecture, Gus. What is it? What is it about the molecular manipulation that?
Well, it's able to attach to those known receptors.
Okay. So it attaches to the taste and smell receptors in the nose and the mouth.
And this was detailed work that I personally.
I see. So it increases the amount of tissues it can bind to.
I wouldn't have picked up that detail. It was Berger did the detail, but as soon as I was aware the receptors were involved in taste and smell. As a clinician, I said, that makes sense. And we know that you can. I did a lot of work with HIV and the CD4 receptor, so I know that there's other things other than the main receptor that determine your pathogenicity. So I was very receptive to this. But what I want to really go to, and I think that this is the highlight. I'm just going to go to the next one. I jump over Omicron because that just showed that it's
the furin cleavage site.
That's the furin cleavage site, which was there, but they ignored. If we go to the next one, this is basically the about Omicron and how it evolved so differently from the others. And this is the reason I like this is because this was the perfect vaccine. Omicron was the most perfect coronavirus vaccine because it was highly infectious and it wasn't
the best virus, you mean, not vaccine.
Best viral vaccine you could have. So we go to the next one. I want to highlight.
And I'm not quite sure. Are we talking about the virus or the vaccine here, Gus?
That's the virus showing how different that modelling had become. And in fact, it had open variants and closed variants, and the fact it was able to open and close, it could still bind to receptors, but it could close and avoid the immune response to it.
Right. So the Omicron is much more immune resistant than the previous. So we've got the Omicron on the right and the previous strain on the left, have we?
They're both the Omicron, but the trimer is open on the left and it's closed on the right, and so it shows that way it was able to avoid immune responses directly to the spike. But I'd like to go to the next slide because this is what became really important. It showed, and the South Africans reported this. There was no difference between the vaccinated and unvaccinated, whether you got infected, ill or dead. Absolutely zero.
With the Omicron,
it meant all the first vaccines were a total waste of time. This was actually good because it did actually cause an immunisation. I was furious at the way London handled this. They treated the South Africans as if their peasants didn't know what they were talking about, when in fact they were actually telling us the clue, the secret, and these guys carried on with the lockdowns. I mean, this should have been an absolute stop the lockdown. They didn't even do that. So the next slide is the really big important one. If we go to that, this is it. This is what we did right at the beginning. Is that as soon as we realised that this virus had been engineered to be hyper infectious, and it has escaped from the lab. And basically, we were silenced. No journal would publish it. Every journal turned down our work with the same words. They said, this is not in the public interest. So how did the editorial board of Nature, Science, Cell, Virology, Lancet, how do they all come to use the same words? This was set up. This was organised. This is what you do. I mean, it's unbelievable. But this slide was the most important of all of this, because I said, if you can't understand charge and you can't understand escape from a lab, you have to understand this, because a blast analysis shows that 80% of that spike protein is homologous with human proteins. Therefore, if you use the spike protein as the vaccine, you are 100% guaranteed to get side effects from it. And therefore, you should avoid it. That simple. You cut this 80% out. But not one major company did this. This
is a really important point here, Gus. So what we're saying is 80% of the spike protein is common with human proteins. Therefore, if you give a vaccine that targets the spike protein, it's inevitable that that's going to target human tissues.
Yeah, exactly. And in fact, there's now 131 conditions have been described as side effects of the vaccine.
Well, why on earth did they pick the spike protein? Why not some envelope protein or something else?
They picked the spike, but what is again sinister that everybody picked the same spike, whether it be AZ, Pfizer, Moderna, the whole lot of them.
Do we know why?
In spite of the warning. And we made this warning very, very high. Now, we found two well-known homologous proteins were 100% homologous. Platelet factor 4.
So it means they're exactly the same as the spike?
Yeah. And myelin. Well, platelet factor 4, that came out as causing dreadful clotting and platelet dysfunction, VITT syndrome. That is very quickly recognised. It killed the AstraZeneca program. And what I will say about AstraZeneca, we know this happened because they let their side effect book open. It was common knowledge and not manipulated like Pfizer and Moderna. So Pfizer and Moderna said theirs is a dangerous vaccine, you must stop using it. But we'll carry on.
Full credit to AstraZeneca, really, for admitting their mistake.
Absolutely. This is the point I actually want to make. Whereas Pfizer and Moderna basically kept their side effect books closed for confidentiality reasons, and indeed applied to have them locked down for 75 years. Well, there's nothing like following the science. If you lock down all your data for 75 years, it means you're not following the science. Now, the other one, which is very important, the myelin.
Yeah, the myelin. This is the sheaths round about the nerves. Yeah,
I mean, this also arises with flu vaccines too.
Does it?
But and Guillain-Barré, which is the disease you get when you get antibodies to myelin, there is a background with flu. But because it was 100% on this one, we knew this was going to be horrendous. And I know loads of people who've had Guillain-Barré, including people in my own family who had the booster vaccines when I told them not to. Their GPs bullied them into it. This is another thing that I'm furious about. And one of the GPs basically said that when they pointed out that I said not to have them, this again was pointed out that I'm a medical oncologist. I know nothing about vaccines and immunology. Roll your arm up, and bullied them into having it. And then they got Guillain-Barré and 6 months paralysis, before it started. So it's the cost to the NHS.
I've worked with these patients in intensive care. They can be paralysed for weeks and months.
Exactly.
And it's a terrifying condition because sometimes they can't breathe properly for weeks.
Yeah. And I know two people in my small social circle and family who were paralysed in hospital with Guillain-Barré immediately after the vaccine. So that means it is unbelievable. And it's on the MHRA website where they use very rare. If you know two people, it's not rare.
Yeah. But completely predictable based on the biochemistry of the spike protein being the same as the receptors on the myelin.
Here's the real crime. I use the word advisedly. They ignored it. Sage, the chief medical officer, the chief scientific officer, everybody ignored this extreme warning. And yet, the whole pandemic response was predicated on the absurd, useless speculation of Neil Ferguson and his what I call teenage scribblers on their PlayStations.
Silly primitive computer modelling, wasn't it?
Yeah, make primitive computer models, making out absurd thing. And they said, we have to act in case this is true. This was 100% science, and they chose to ignore it.
Yeah. So he had an unjustified assumption followed by unjustified assumption. Into an arbitrary equation that generated an arbitrary outcome.
Yeah.
And the government acted on that and ignored proper science. It really is quite, Yeah. It's understandable for politicians, but their medical advisors should have been a bit more switched on, I would have thought.
And the MHRA and regulatory authorities, I have to put that down. They are totally, utterly incompetent. It's the only word. They're either incompetent or they were bribed to look the other way, or both. Neither explanation is acceptable.
Yep. Quite bizarre. Where are we going now?
Now, I'd like to finish on this for this section.
Yep, please do.
If we could.
Yep.
Because when I stand up and do these things, I might get that we're getting less and less problems, but somebody would stand up and say, well, it's very easy to be right in retrospect. This is why this slide, and I think for this session will be the last one, because I think it shows it is not retrospect. This was all prospect. We had to disguise came from the lab and affects how you design a vaccine. We got it into the quarterly review of biophysics discovery, a journal I'd never heard of before. And we had to change the title, because as soon as it suggested it came from the lab, every journal turned it down. Fortunately, the editor of this journal, being a biophysicist, understood the charge argument immediately. And he said, that's really important. We want to put it in. So that's how we got it in.
But the key thing is you've got the publication there from the middle of 2020.
So it was all there, and it was all submitted to Cabinet and everybody. It went through directly to Michael Gove, who gave it to people who won't try and hide that. But this last paper is probably even more damning and important. Here it says this title is Mitigating Coronavirus-Induced Dysfunctional Immunity, for that's what it does. It destroys your immune response to anything. Trained immunity, BCG, and new old friends. And here we actually do probably the best review of how IMM 101, Mycobacteria obiense, works in the entire literature. It's probably the best review. But not before we go through the following. It's probably the only review that reviewed all coronavirus vaccine attempts to date and pointed out why they all failed. The reason they all fail is they have this amazing ability to induce antigenic sin or immunological imprinting. What this means is that once the immune system has seen the vaccine, it won't see anything remotely similar to it. It just pump out antibodies to this vaccine, which has been made against a virus which mutates so fast it wasn't even around when the vaccines were introduced 9 months later, let alone
you're producing antibodies to the vaccine, but not producing antibodies to the current virus.
Exactly. And this means that the antibodies are completely useless and they end up enhancing infection because they bind to other coronaviruses that look like coronaviruses, but they bind to a bit and don't neutralize it, bring it into the cell and enhance infection. And this
so
is
when it's in the cell, the virus can then multiply in the cell.
Multiplies. And we said that this will actually mean that the vaccines will be worse than useless. They will enhance infection. And by the way, we just like to point out, why did anybody who was developing these vaccines not note that all the attempts when they get into primates are fatal? So why do coronavirus vaccines, why are they fatal in primates? Everyone seems to have ignored that and not bothered with that. But
I didn't know that. So if you give the current generation of vaccines to monkeys, it kills them.
No, this was the previous ones before. I think you'll find they didn't bother with primates because they knew about this, so they weren't going to do it. So the bottom line of all this is that not only did this predict that the vaccines would be useless, but also they'd make things even worse. Now, the Cleveland Clinic has continued to update to the point now where they show that for each vaccine, your chances of getting COVID go up. It's now over 3.5 times that if you didn't have the booster. So they've actually charted it, and give them their due. They have published this.
Yeah.
They have published it. They started, it was vaccines program for their staff. And it clearly shows that the staff who didn't get vaccinated did far better, and the people who have the boosters go down with COVID. Well, that's exactly what I observed in hospital. All the people in my staff who had the boosters, they were the ones, were off for a week with dreadful COVID the week next. And so anyway, I'd like to stop there.
That's fine, Gus. Thank you. Yeah.
And then go into the other issues. So we can actually go into them in depth, because it was there. And as you say, I couldn't do that on this programme. The most we ever had was 45 minutes.
Yeah.
So
they were the complaints I was getting from Australia. Yeah. Great. For now, Professor, wonderful stuff. Thank you, and hopefully we'll come back and do some more soon.
Okay.
Yeah, thank you very much.
All right. Bye.
Thanks. Bye.